It's late afternoon and an air ambulance is arriving from country Victoria with a seriously injured car crash victim. The injured man is one of more than 500 patients airlifted to the Royal Melbourne Hospital each year.
Got it? Nice and slow, guys.
23-year-old Jack was trapped in his ute for nearly an hour, and paramedics suspect he has fractured bones and a dislocated hip. So treating him is time critical.
What's his name?
Hi, Jack.
Hi, Jack. I'm Jason. I'm one of the doctors.
How are you?
So I'll be looking after you today.
Dr. Jason Gabriel Anasaur needs to quickly assess if Jack's injuries are life-threatening.
Everybody ready?
This might hurt a little bit, okay?
Ready, set, go.
Good work, Jack.
It's just my hip.
This is Jack. He's driving on a 100k zone area in an older style ute. Has left the road and hit a large post, hit it head on, trapped in the vehicle for a prolonged period of time. When we finally got him out and onto the stretcher, basically his left leg was extended up in that position.
And can you remember what happened?
When's that?
In the accident, you've had a car accident, so you've been brought by helicopter to the Royal Melbourne Hospital.
Oh, you kidding?
So you can't remember anything?
No.
All right. First thoughts, the obvious thing is he's got hip pain, so he's got potential for internal injuries. We'll get some x-rays now to have a look at that left hip where he seems sore and he can't really straighten, to look and see if he's broken anything or if he's dislocated anything. This hip is dislocated, Jack.
Feels like it.
So we're gonna give you some medication to make you a bit sleepy so that we can pop it back in, okay?
Putting a hip back in place is a difficult and risky procedure. So Dr. Jason calls his supervisor, Dr. Maya Kubert, to meet him in trauma for help.
Right, this looks unhappy to me. We are looking at an X-ray where his hip is clearly dislocated, but he's also had quite a significant injury where he's been in a car accident, he's had a period of time entrapped in the car, so we know we need to pull this hip and put it back in, but what we don't know is there any other injury that we will potentially make worse? Have you had any alcohol or other drugs today? It's not a problem, I just need to know so that I can give you the right things. Okay.
Had a beer last night before bed, that was it.
Back in Trauma Room 1, Dr. Maya Kubert is assessing 23-year-old car crash victim Jack after his ute slammed into a pole. He's been given pain relief, but his dislocated hip needs urgent attention.
So the hip is this little ball that sits inside a socket, like that, and yours is sitting out. It's a really common thing that happens when the dashboard pushes against your knee, pops it out the back.
Feels like a prick of a thing.
There is always a risk in a hip dislocation that if we don't manage it in a timely fashion, the part of the body that has been moved is at risk of not having enough blood supply to remain viable. In other words, the bone dies. All right, so CT first.
Okay.
Before attempting to pull the hip back into place, Dr. Maya needs a detailed scan to make sure Jack has no other internal injuries.
We don't want to try and pull it. If there's any chance, we will move things around or damage his pelvis.
Looks like he's taken a chunk off of his femoral head.
It's bad news. The scan reveals Jack's thigh bone is fractured.
Which could make it a bit trickier to try and pop it back in.
Jack's returned to the trauma room where he can be sedated ahead of the procedure.
All right, Jack, gonna drift you off to sleep now, okay?
In a patient like this, who's young, healthy, with large muscle mass, we know going into it that it will require a significant amount of sedation.
Good idea.
Started, not started?
Just drifted off.
Dr. Maya has called in extra help to attempt the physically difficult hip relocation.
So there's two people pulling in exactly opposite directions. One pushing down to keep the pelvis down and one pulling up to pull the hip joint back into place. You can imagine to get it go back in requires a lot of force because at that point, once it's out, the muscles around it spasm. So what we're trying to do is to use drugs to relax the muscles and the body.
But there are risks with giving sedatives. Jack could stop breathing.
Just another 50 of propofol.
Are you in?
The team's struggling, so veteran emergency doctor Jonathan Papson arrives to give them a hand.
Jack's a big guy, so when I go in there, my eyes are rolling in my head thinking, oh, this is going to be hard work. Do you want me to press on the pelvis? Yeah.
Do you want to move him over a bit, guys? Do you want the bed down? Go for it, go for it. You're just going the end. Yeah. Push them both together.
Oh, he's rolling away.
Bag there, mate.
So I'm ready to sing.
When we go into a procedure like this, there's a risk we won't be able to move it back into the right place.
Dr. Jonathan Papson throws himself into the task, but he's worried time is running out.
You need to see to the hip dislocation quickly because if it's out of the socket for too long, the hip head will actually degenerate. He's going to have a wrecked hip, he won't be able to walk.
You want to have a go?
Oh, I can have a go. Sometimes, just some other position, isn't it? Sometimes. There we go.
Yeah.
I think so.
Yeah, felt it click in.
Yeah, it's clicked. Whew. Good work. Good job. It's physically difficult to do. We effectively have to fight against the muscles until we find the right position where it clicks back. So that's what we're doing, which is hard because he's a strong guy. So we just want to re-X-ray it, make sure it's actually in. It felt like it clicked back in. Sometimes they click in and they click out again, or they grate just on the edge and they don't actually pop back. But I definitely felt a pop, so confident.
Dr. Jonathan appears to have finally gotten Jack's hip back in place.
Need a new bag valve mask and I need an airway nurse, please.
But without warning, there's a new, potentially fatal complication. Jack has stopped breathing.
Can you hook me up a CO2 that's in line?
Are you okay?
He is flat as a pancake.
The real problem now is that he's not breathing because we've given him so much sedation. So we just need to support his breathing until the anaesthetic wears off, essentially. To relocate a hip is a big deal because you need to deeply sedate the patient, and the deep sedation of a trauma patient is very dangerous. So you all right?
Started to breathe up on his own. Yeah, look at that. There we go.
With Jack breathing again, the team can check if his hip is definitely in its socket.
Yeah, we're okay. I think we're okay to put it back on.
So I can call a mobile X-ray. We can check this is in. If it's not in, we can keep playing, I guess. Yeah, that'll be fun.
The team anxiously wait for the X-ray. It's the moment of truth. Is the hip back in place?
Oh, beautiful. Beautiful.
It's all good.
Yeah. You're good.
So it's back in the joint now at least. So it's not dislocated anymore.
Now that Jack's awake again, he can have friends visit.
You're doing cartwheels in no time.
Before her shift ends, Maya debriefs with Jonathan.
Thanks, Jonathan.
So was the hip in?
Yeah, the hip's in.
Yeah, thank God for that.
Yeah. So what's your technique, Doctor?
It's just
Give us your learning.
No, look, I just tried a few different angles.
Yeah.
And then it just kind of clicked.
Thanks
just
for
the right
popping your
position,
head in.
that's all right. Answer phone calls all day, put hips back in. What am I going to take? I'll take the hip any day. It's really satisfying to relocate a joint at the end of the day. It's good stuff. It's nice to fix things.